Hi, my name is Michelle Menner. This is my daughter Haley, and she is posing as the 38-year-old patient who sustained an injury after motor vehicle accident. Hi, Hal. Let's go ahead and get started. We're going to begin with the shoulder. As you can see, Haley is positioned in the supine position, comfortably resting and fully supported. The first joint mobilization is going to be at the glenohumeral joint, and we're going to do joint traction. I plan to provide a grade 3 joint mobilization for the general shoulder mobility as she reports her shoulder is more stiff than pain. My mobilizing hand is placed in the axilla with my thumb just distal to the joint margin anteriorly and my fingers resting posteriorly. My other hand is supporting the humerus laterally. You don't need to do anything, okay, babe? I'm going to go ahead and do some joint motos. 1, 2, 3. Her whole arm moves. My second joint mobilization is going to be a caudal glide to increase abduction. Again, in order to increase joint range of motion, grade 3 or 4 mobilizations are required. I'm going to choose a grade 3 joint mobilization. One hand is placed in the patient's axilla, and the web of my other hand is positioned at the top of her acromion, and I'm going to push inferiorly. So grade 1, grade 2, grade 3, just try to relax. 2. My third joint mobilization for the shoulder is going to be a posterior glide to increase shoulder flexion. As her elbow becomes less tender, I may consider a posterior glide progression with the forces going through the elbow, but at this point with her shoulder being so sensitive, I'm going to stick with just a posterior glide. I'm changing my body position slightly by putting my back towards her and resting her arm fully against my trunk. And the lateral border of my mobilizing hand is placed just distal to the anterior margin of the joint. So, this is again to increase shoulder flexion. Grade 1, grade 2, a little bit bigger movements. Grade 3, all the way to her end range. We're going to stop there. All right. My fourth joint mobilization of the shoulder is an anterior glide. Go ahead and sit up, and we're going to lay on your belly, Haley. And scoot towards the edge. Good job. Make sure you're comfortable. I'm going to place this under her acromion for stabilization. So I've got her in the prone position. I'm going to let my videographer come to the other side. My foot, this is to increase external rotation. So her arm is fully supported over the side, and I've put an on my thigh as well. And I placed a pad underneath her acromion for stabilization, and I'm going to go ahead and place my mobilizing hand just distal to the posterior angle of the acromion process as I apply an anterior glide. And note that my knees are bending with each oscillation. I'm going to have you scoot just a little bit more over, Haley. There you go. With each oscillation so that the entire arm moves in the anterior direction. So, grade 1, grade 2, grade 3 is where we're going to go. gonna flip back. Oh, nope, you know what, you're gonna stay here. Because we're gonna go ahead and just work on your shoulder, but I'm gonna have you, or your elbow, and I'm gonna have you slide a little bit to the side. All right, and I'm gonna move our pad down. So because the elbow is her most painful joint, I'm gonna choose grade 1 and grade 2 joint mobilizations for pain management. The first joint mobilization for the elbow will increase elbow extension. The patient is gonna remain in the prone position with a towel supporting under her humerus. My mobilizing hand is placed on the distal humerus, and I'm going to change my spot again, and my thigh, and the opposite hand is resting on is supporting the rest of her upper extremity. I'm completing grade 1 joint mobilizations for pain. Of course, I've assessed her available range of motion. It's barely moving. Great. And then we're going to go ahead and transition back into supine. So go ahead and we're going to lay back on your back, Haley. We're going to stick at the elbow. And the second joint mobilization is going to be a distal glide to increase elbow flexion. My hands are placed at the joint line as I provide a gentle distraction and physiological flexion into grade 1 joint mobilizations. So barely moving. I know it's painful, right? No. So it's almost a scooping or a cupping motion with distraction and a scoop and deflection. And then the third joint mobilization for the elbow is just a general joint traction to increase both flexion and extension. I'm going to try and provide grade 2 mobilizations. I'm going to place some padding just underneath, or just proximal to the olecranon process, and the patient's wrist is going to rest against my shoulder for support. My hands are on the joint lines as I'm going to provide a straight out distraction force without the cupping this time. So grade 1, grade 2, bigger movement, not to the end range. Okay. And then in order to treat her wrist effectively, I'm going to have her sit up in a supported position, and that way I'll have more control and better body mechanics. So right there. To accomplish what I want. So I've placed a towel roll underneath her arm for comfort. And then the first wrist mobilization is going to be a general traction, joint mobilization 2. And I'm doing that just for general joint mobility to increase the joint lubrication. I'm grasping around the styloid process and fixating the radius and the ulna against the radius and the ulna. So my mobilizing hand, which is going to be my left hand, grabs around the distal row of the carpals as I pull out in a distal direction with respect to the arm. So we'll start with grade 1, grade 2, and we'll just kind of hang there. Even though her wrist isn't super painful, it's not painful, it's just stiff. I'm really just using the grade 2s as a way to, like I said, increase the joint synovial fluid. The second wrist joint mobilization is going to be a grade 4 dorsal glide. Because she lacks any pain, I feel like we can go ahead and do a grade 4 to go ahead and get that full range of motion restored. And we're going to do a dorsal glide to increased wrist flexion. I again am going to grasp around the styloid processes and fixate the radius and ulna. My mobilizing hand grasps around the distal row of the carpals, and I move in an upward direction with respect to the arm. So 1, and I'm going to stand up for this. 2, 3, big movement to her end range, and then 4. Does that feel funny? All right, and that again is to increase flexion. And then the third wrist joint mobilization is going to be a grade 4 volar glide. And again, due to lack of wrist pain, we're going to stick with the grade 4s, and we're going to increase extension with this joint mobilization. I'm grasping around the styloid process and fixating the radius and the ulna against the padding, and my mobilizing hand grasps around the distal row of carpals as I mobilize them downward. So I'm assessing her joint mobility. 1, 2, a bigger amplitude, but not to end range. 3, big amplitude to end range. And 4, small amplitude past end range. All right. Thank you for your time.